Students across Utah heading back to the classroom today amid the Omicron surge. Parents are also sorting through new guidelines for quarantine and isolation periods. News Specialist Ladd Egan continues her team coverage tonight to explain these changes. Ladd?
Well, state and local health departments are passing along these updated guidelines to school district. This comes after what the CDC updated last week. This is effective immediately, and Utah's update actually goes beyond what the CDC did because this applies to students. The state health department says that the CDC is considering additional changes to the isolation and quarantine policies because we are expecting the CDC to give us more updates on exactly what they want for school-related protocols. Looks like we'll have trouble playing that video right now. For now, I'll send it back to you, and we'll get that video playing when we can.
All right, Ladd, thank you. Yeah, we'll try and get that information for you. Let's move on here, though. As mentioned briefly there, those updated quarantine guidelines come from the Utah Department of Health and largely mirror the new recommendations from the CDC. Adults testing positive for COVID should stay home at least 5 days from a positive test, regardless of symptoms. Now, if you're feeling better after 5 days, you can resume normal activities as long as you no longer have any symptoms and you wear a mask. There's no need to quarantine at home anymore if you have been exposed to somebody with COVID and you are fully vaccinated, but you should wear a mask for 10 days, they say. If you have not been vaccinated, you should quarantine at home for 5 days if you've been exposed to someone with COVID, and then wear a mask for 5 more days. Deanie?